HT and the Metaneb. So before entering a patient's room, we're going to go ahead and check the patient's chart, make sure there's no contraindications for using the Metaneb. That would include hemoptysis, untreated pneumothorax, ICP greater than 15, any facial trauma. The patient does not have to be alert and oriented to use this. We use this on bedded patients all the time. This is when what the therapy does is lung expansion, airway clearance, and aerosol delivery. So it's a 3-in-1 kind of device, and it's really versatile. So we would also check the patient's chart to see what kind of medications we could bring to the patient's room before doing this. So we'll enter the patient's room, introduce ourselves. Hi, my name's Kate. I'm with Respiratory. It looks like today the doctor, we have you doing some Metaneb therapy, and like I just said earlier, I'll explain to the patient that this is for help you to move those secretions, also to give you your medication, aerosol delivery, and to help with lung expansion, so to treat and prevent atelectasis. So we can use either a face mask, anesthesia face mask, because we need a tight seal around the mouthpiece, or they can use a mouthpiece here, or we can use we can go ahead and hook this up to a ventilated patient. So for my patient, I'm going to instruct them that they need to sit upright and go ahead and create a tight seal around their mouth, this mouthpiece, and they need to breathe through their mouth, not through their nose. If they're having trouble breathing, just breathing through their mouth, we have a little nose clip we could put on them. So I'll go ahead and put the medication in here. If we're not doing any medication, we just use regular saline to put in there. And then I'll go ahead and hook up the Metaneb the circuit here to the device. So on the bottom portion of the Metaneb, there's a little insert. It kind of goes in sideways a little bit. You put it in and click it down to make sure it's secure. And then there's a top button on top here. We'll just turn it on. Patient has a tight seal around, and we'll start them off on the aerosol delivery mode. We want the flow. The flow will start off all the way towards the lesser flow. We'll do this for 2.5 minutes, and we're monitoring on this manometer here their pressures. We want it in between 10 to 20. And if they're not reaching the therapeutic pressure, then we can increase the flow to get them to that point. Then after we start them off there, we'll go ahead and click them up to the continuous high flow oscillation. We can pick the rate of oscillation here, a little faster or slower, make our patient work. We want to push our patient, but also really monitoring them while we're doing it. We definitely want to monitor their respiratory rate, because it's very easy for patients to hyperventilate while they're doing this and become lightheaded, and so we need to be actively coaching and participating with our patient while they're doing this therapy. After we do that for 2.5 minutes, we'll click them back down to the aerosol delivery mode. Give them a little bit of a break. It is quite a workout. I tried it multiple times, and I don't have any health problems. So imagine being sick and doing it. It is quite a workout. The patient's going to need some encouraging along the way. Then I'll go ahead and kick them down to the continuous positive expiratory pressure. And that is going to, we'll do that for 2.5 minutes. It's a lot like the Easy Tap. That's where they're opening up those alveoli and preventing and treating atelectasis. So this whole treatment is about 10 minutes. The patient, we want to push them. We want to make sure that their pressures are up and above that 10 marker. And if not even higher, probably like 15 to 20 would be even better. And we really want to make sure our patients are pushing themselves, get them out of the ICUs, so or out of the hospital. I would ask that the patient, afterwards I'd listen, or before and after I'd listen to their lung sounds and see if there was any improvement in their work of breathing or any decrease in the secretions when I was listening to their lung sounds, to see if the therapy was beneficial or not, and then make sure that my patient was comfortable, and that's it.